Hello, this is Dr. Colin Kep in DC. Welcome to Active Rest. What I'm going to go over right now are your do's and don'ts and possible changes after your first correction. Many of you have just received your first correction. There's a chance you're seeing this just before your first correction, and that's okay. These rules will apply to your general life as well. So first thing is, please don't pull on or crack your own neck. A lot of people have that habit. They'll just reach up and crack their own neck. And yes, I did it every day for 10 years. That's part of what drove me into this profession. But now that I've corrected it, please don't mess with it. The body may have some cracks in a lower area on its own. If something clicks or pops on its own, that's fine. Just make note of it and let me know. Of course, please don't do any ballistic extreme exercise in the next 24 hours. One-armed kettlebell whips, golf or tennis, inversions in yoga, extreme ballistic jumping, hopping, CrossFit, things of that nature. Take the next 24 hours and take care of yourself. If you want to go on a walk, that's fine. The other thing is a light yoga class perhaps tomorrow for those of you who do flexibility in yoga. That is fine as well, as long as it's not the extreme inversions that I was referring to. What I want you to do now, though, with the neck and body, we call it the robot, is keep the head on straight and just move the body. An easy way to remember this if you're driving out of here is turn from the tailbone. If you turn from the tailbone, your whole body will move with you. And of course, this is for the first 24 hours will be strict. After the second correction, I want you to be strict through the end of that evening. And after that, you'll be able to slowly, smoothly restore your movement. But we're doing this so your body can heal itself in the correct position for your results, so you get better and faster results. It's also okay to have some soreness afterwards. If you have a soreness, just like a workout soreness, that's fine, especially in the areas that I worked on. They're going to change, and change is a good sign. And soreness, if it's a regular to moderate workout soreness like you would have at the gym, that is good. If it's sharp, painful, stabbing, or referring symptoms down to an arm or a leg, then you get in touch with us. If it seems very odd and not like a normal soreness, then get in touch with us, give us a call, and we'll talk to you about that. What happens also after your first correction is that your parasympathetic, your rest and digest nervous system gets stimulated or gets put back online, so to speak. So it's very common. The most common reported symptom I have after the first correction is just to feel relaxed and calm. And so take the rest of today and go home and just guard the neck. We'd like to have you lie down for a solid 45 minutes, let's say in an easy chair or recliner. You can stay right here if you're in the office in the massage chair for a period of time. You don't have to leave. I'd rather have you stay here and hold your correction than go out into a car and have you turning your head in traffic. So those are the do's and don'ts. Of course, eventually after the 4-day process is complete, we want to get you on corrective exercise program to hold everything in the right position. Now we've got the possible changes, and the first possible change, like I mentioned before, is feeling calm and relaxed. Other possible changes, if you had a lymphatic buildup, the lymph can flow downward into the body and make you feel like you're getting ill for a short period of time, but it'll go away fast. It'll come on, am I getting ill? No, I'm not. Oh, it's gone, is typically the response that people have, but that's typically if there's lymphatic blockage here and that we've released that. Some people feel changes in head pressure as the arteries, veins, and the cerebrospinal fluid inside the head change its pressure. You can sense that, and it can feel like a dull head pressure. It can be slightly achy, but as well, that will resolve quickly. It won't be a migraine or something like that that'll last for days. The pressure will come and it'll go, and that's perfectly normal. Some people will walk out of here and feel like their legs are different lengths, and when we change body balance from imbalanced to being balanced, if your body's used to being imbalanced, you're going to walk out balanced and it'll feel wrong. So if you're used to being wrong, if I correct you, it might not feel the same walking out of here, and that's also a really good sign. So the possible changes, just make note of what they are and come back to us on your next visit and let me know about them, and I'd be happy to hear all about it. And if you have any questions, get in touch with us. Thank you. Hello, my name is Colin Kep in DC, and all of us here at Active Rest want to show you the true paradigm of self-healing. The important fact and the philosophy that we have is that the body heals from the inside out. So let's say you have a 4-year-old child and they accidentally cut their finger and you put a band-aid on their finger. They may tell you, look, the band-aid healed my finger. But the fact is that the body healed itself from the inside out, and the band-aid just removed interference, things from interfering with the body's own natural healing process. So one of the problems we have in modern life is that we're looking for things from the outside in to heal us. But what we need is to have our healing from the inside out be expressed. So here's the diagram. The brain is responsible for communicating the healing process and keeping you alive, and the brainstem area keeps you alive when you're asleep. So the brain-to-body communication, we want it near 100% for you, as high as we can possibly get it. If there's an interference between the brain and body and the nervous system, and an interference in communication we call subluxation. The traditional meaning is minor dislocation, if you want to translate it directly, is the bone has a misalignment in it. But the other alternate meaning, which is my favorite, is that lux means light, which means if that's out of place, it's blocking your light. It's blocking the power on in your body. And of course, we believe that the power that made the body can heal the body. So what we do with upper cervical, meaning top of the neck, is that we correct that area at the top of the neck so the brain body can communicate and your power is fully on. What I find though over and over is that people not only have one problem, they have an entire chain of compensations through the body. We call this body imbalance, which is shown right here by this little figure. There can be multiple areas of muscle spasms, knots. We'll call it fuzz, which brings us down a little bit lower on our list. So to correct body imbalance, we want you to go on a corrective exercise regimen. You can look up the videos online. There's a whole YouTube channel with corrective exercises, and also consult your local professional. We have resources here with many great corrective exercise professionals we can refer you to if you'd like. Our overall goal in life, though, is to have 100% function. I want your body to work. I want everything in your body to work correctly. I want you to be able to do everything that you would like to do in life. That's called 100% function. So we've got full communication between the brain and body. We've taken away the imbalance and created balance. And then, instead of having malfunction or dysfunction, I want you to have 100% function. For example, let's say you have TMJ / the modern definition is called TMD, temporal mandibular joint dysfunction. Dysfunction meaning the jaw doesn't work right and you can't chew correctly. You have popping, pain, and other problems. What we do is restore the upper neck balance and the corrective motion of the jaw to help it work correctly. And of course, active release is a big part of that. Like I mentioned earlier, the fuzz or scar tissue or adhesions or knots in the body, there's many words to express how the body can have knots and painful areas in it. But long story short is that active release techniques break up that fuzzy scar tissue and restore, instead of having malfunction and dis-ease, which means you're not at ease, we want you to have ease, have fluid movement, be able to do everything you want to do. Pick up the grandchildren, be able to travel and put your suitcases on the rack, play your favorite sport, improve your tennis serve, your golf swing. Think of whatever you want to be able to do in life. And that's an example of function. And I want it to be easy for you to do it, as opposed to barely getting by, barely being able to get out of bed, and that type of thing. That's dis-ease, when it takes you a half an hour to get out of bed, when you grunt when you get up and down, in and out of the car. That's an example of dis-ease. So we want you to have ease, and at the end we want you to have no symptoms, because we found if you're on the path towards ideal health, your pain will go away early in the process. But you have to focus towards being better than ever in your ideal health and life. And a lot of this comes down to your responsibility. It's going to take a lot of effort on your behalf to be able to take this path and see it all the way through. So, basic self-healing diagram. Turn the power on, balance the body, make sure you're doing corrective exercise. Active release takes care of the knots and balances the body. And eventually you take responsibility for that. Thank you. Hello, this is Colin Kep in DC, and welcome to Active Rest for your second correction. We call this day 2 of the 4-day test phase. And on day 2, our theme is we want you to have 100% function. We want you to realize that being out of pain does not mean that you have 100% function. Making sure everything is working correctly, every cell, tissue, and organ in the body, that means you have 100% function. I want everything to work right. I want you to be able to do everything that you want to do and make it easy and comfortable to do so. So the important part about this, I want to reiterate the laws of healing that I showed you in the consultation in day 1. The laws of healing for adults, it's an 8-week cycle. For younger, say teenagers, might be a 6-week cycle. That's the law for the body to heal and its cells to make new lines of fresh connective tissue for your body to heal in the right place. Some people need 1 cycle or more, it depends on the case and how long the condition has been there. And we'll figure that out by day 4. But what we're going to do today is a preliminary report of findings where I make an estimate based on your progress so far, and then we'll write all that down and go over that with you, with the laws of healing and the cycles, and make sure this all makes sense for your case. And always be ready for your quiz.